There is a way that you can get rid of pain, spinal pain, knee pain, back pain, neck pain without surgery, and you don't have to travel abroad. We brought abroad to you. In this center, we have doctors, physiotherapists, and specialists from Canada, from different parts of the world, right here in the very first spine and nerve center in Nigeria.
So my name is Dr. Craig Slipinski. I'm the clinic director here at Spine and Nerve Center, Nigeria. I specialize in non-surgical spinal decompression and peripheral neuropathy.
I just want to go into the facility now to talk about what the patient experience would be like.
Sure. We're able to treat people that have severe and chronic back and neck pain in a safe and effective manner. We're actually helping to regrow and heal the disc in a non-invasive manner.
In what way?
Most people that are having issues with their back, it's a problem with what's called the intervertebral disc. It's like a cushion that helps to absorb force and then allows you to move your spine.
Okay.
If we don't follow good spinal hygiene, that disc begins to break down. And when that disc begins to break down, that disc will protrude out and hit the nerve. So we're creating a negative pressure to help retract that disc naturally, and then we're making the disc stronger. We're not removing anything such as in surgery. We're not masking any of the symptoms such as with medication.
Are we saying that every pain can be solved with this, surgery is non-essential?
No, absolutely not. But for a vast majority of the time, surgery can be avoided.
Okay.
We accept about 90% of the patients that come in here, but 10% of the patients we have to reject and we have to send them for surgery.
I want you to tell me a bit about patient outcomes.
You basically see two types of patients. You either see patients where they've had an injury that happened right away and then they need treatment, or in this case in Nigeria, we see a lot of people who've had really chronic pain. So they've had this pain for years and years and years. And obviously people who've had pain that have come on recently typically respond a little bit quicker. I would say the vast majority of our patients do respond pretty well despite having a very long window of chronic pain before.
So I think the final thing is the peripheral neuropathy.
So peripheral neuropathy is when you're getting a numbness and a burning in your legs or hands. And typically the nerves, they begin to degenerate. And it starts with the nerves in the feet and the hands because that's where the nerves are smallest and that's where the blood vessels are smallest. And if it's not treated, it's a progressive disease. It'll get worse and worse.
What would you consider causative factors?
Diabetes is the big one.
Okay.
In chemotherapy, and sometimes it's just idiopathic. People don't know what's going on, but most of it is diabetic or even pre-diabetic.
Chronic pain is a very big issue in Nigeria. Everybody and their uncle either has knee pain, lower back pain, one form of pain or the other, or something to do with the spine or something to do with the nerves or one form of sciatica or whatever. There's just so much pain. And the funny thing is that people have been living with this pain for a very long time. Seek professional help. Spine and Nerve Center Nigeria is one of the places that can achieve that for you. You wouldn't need surgery for a lot of the pain. Please come and check if you qualify for some of the treatments that are here and say goodbye to that pain.